Hey there, health enthusiasts! Want to know about the vitamin? The one vitamin you absolutely can't miss out on. Well, you have come to the right place. In this video, we are going to let you in on the secret to getting this vitamin in your diet so you can stop worrying about deficiency and start being the healthiest version of yourself. And if you are still feeling unsure, don't worry. We will also cover the best options for vitamin supplements when it comes to this vitamin. So sit back, relax, and get ready to become the envy of all of your friends with your newfound knowledge of the most important vitamin out there. Trust us, you don't want to miss this. Magnesium is a mineral that is necessary for the brain and body. Among its numerous advantages is that it helps manage blood sugar, for example, number one, right? Magnesium deficiency is very common among diabetics. A deficit that can occur actually in both type 1 and type 2 diabetes, but type 2 appears to be, in type 2 diabetics, appears to be more common. This is because low magnesium levels are linked to, fill in the gaps, insulin resistance. Taking a magnesium supplement, on the other hand, can raise your magnesium blood level and help you control your diabetes. Now, how? Supplementation may enhance blood sugar levels, we know that. Maybe even sometimes prevent type 2 diabetes if you have pre-diabetes. It may. I'm not saying it will, it may, right? Based on the studies. Magnesium is one of the basic minerals required for human health, although it has so far been the only one linked to actually pre-diabetes. There is also a lot of evidence that magnesium helps people with type 2 diabetes, but did you know it also helps those with insulin resistance and pre-diabetes? Well, first of all, magnesium lowers the fasting blood sugar levels, insulin resistance, and inflammation. And blood glucose levels even are better at 2 hours after a glucose tolerance test when we do these testing in pre-diabetic people. Now, continue watching to learn more about the magnesium because you will see how it really affects you and how to increase your consumption and whether magnesium supplements are important personally for you and what are the best magnesium supplements out there. Now, what exactly magnesium is for, right? Well, after calcium, sodium, and potassium, magnesium is the fourth most abundant mineral in the human body. The average adult's body has roughly 25 grams of magnesium, with approximately 53% stored in your bones, 27% in your muscle, 20% in your soft tissues, and less than 1% in blood. Because less than 1% of magnesium is stored in the blood, serum and plasma magnesium levels do not reliably indicate the real magnesium levels in your body. Magnesium is really essential for human health since it is required by approximately 300 enzymes, which are certain proteins, to perform various processes such as protein synthesis, energy production, blood pressure regulation, and blood glucose control. Now, magnesium is also needed for bone formation, your muscles, your heart, the nerve function, as well as the production of genetic materials such as DNA and RNA, and also important for the antioxidant glutathione. What exactly is the connection then between the magnesium and insulin resistance, right? And diabetes and pre-diabetes? Well, magnesium is an important cofactor in carbohydrate processing pathways. It increases the sensitivity of cells to insulin, enhances the insulin secretion from pancreatic beta cells, and allows insulin to carry out its activity of encouraging the fat, muscle, and liver cells to basically absorb the glucose from the circulation. When magnesium levels are low or inadequate, cells in the body have a diminished ability to absorb glucose from the bloodstream. Of course, the pancreas cannot make enough insulin, and insulin is also less effective. Now, all of these factors contribute to insulin resistance. Notably, magnesium deficiency reduces antioxidant production, particularly the glutathione, which as a result increases the inflammation and promotes insulin resistance. When blood glucose levels are higher than normal, but not high enough to be classified as type 2 diabetes, we call it prediabetes, insulin resistance, you name it, but the end results are fairly the same. So it is more common in those who have insulin resistance or whose pancreas doesn't produce enough insulin to have these abnormal blood sugar levels, and we call it diabetes, right? But when cells lose their insulin sensitivity, the glucose levels in the blood remain elevated, and that is then inevitably type 2 diabetes. Now, previous research has linked low magnesium levels to an increased risk of prediabetes and diabetes. A Rotterdam study actually looked at the relationship between magnesium levels and prediabetes risk in around almost 9,000 people. The participants' average age was around 64 years and almost 60% were female. After a median of like around 6 years, 1,100 of that other 7,000 patients with normal glucose levels at the start, for example, of the research, they developed diabetes. Even after controlling for confounding factors, the researchers discovered that even a 0.1 millimole per liter fall in blood magnesium levels was associated with a 12% greater risk of developing prediabetes. They also discovered a relationship between insulin resistance and magnesium levels directly. Now, notably, insulin resistance was responsible for 13% of the effect of low magnesium levels on the risk of prediabetes. Low magnesium levels in general will lower the insulin secretion and action, as we discussed, raising the risk of insulin resistance and prediabetes. So what are then the many forms of magnesium? Because there's so many magnesiums out there, right? The next question is, okay, what do I do? Which one is the best if you have diabetes? Well, magnesium comes in a variety of forms, including magnesium glycinate, which is my favorite, and everybody's favorite. It should be everybody's favorite. And there's magnesium oxide, there's magnesium chloride, there's magnesium gluconate, there's magnesium aspartate, and then goes on and on and on. Now, magnesium supplements are not all the same. Different types are better for different problems, and they are absorbed at different rates. Now, educated individuals like the Sugar MD audience frequently will prefer magnesium glycinate instead of other magnesium supplements because they just learned that the body absorbs magnesium glycinate more easily than the other magnesiums. It is also one of the least irritating nutrients to stomach. It may not cause as many adverse effects as the other kinds of magnesium. What are the side effects of taking magnesium supplements, of the ones that are not magnesium glycinate especially? Upset stomach and loose stools. Some of you probably will be like, nodding your head right now. That is why we know now to include magnesium glycinate in our diavitamin. Sugar MD diavitamin supplement now has magnesium glycinate. And also it includes pretty much everything a diabetic needs for daily vitamins such as alpha lipoic acid, vitamin D, B12, and so forth. Now, how about you don't want to take pills, you don't want to take supplements maybe, then how can you include more magnesium in your diet, right? Well, although supplementation can correct the low magnesium blood levels quickly, you can also raise it naturally, although slowly, through your diet. According to the National Institute of Health, the recommended daily magnesium intake for adults is 320 milligrams to up to 400 milligrams for females, but magnesium is really pretty abundant in many plants and animal products too. For example, green leafy vegetables like spinach, collard greens, and so on, and some nuts and seeds, peanuts, peanut butter, avocados, chicken breast, ground beef, broccoli, even yogurt. Although magnesium levels will vary depending on the water source, but the mineral water and bottled water sometimes are all good sources of magnesium as well. A total serum magnesium blood test can be used to identify magnesium insufficiency, right? That's the only way we can actually test it right now. But loss of appetite, nausea, muscle cramps, and exhaustion are all symptoms of a severe deficiency. Of course, there are other health advantages of magnesium that we know of other than helping the blood sugar levels. Really, magnesium levels, when they're healthy in your blood, it helps control your blood pressure levels. It helps reduce the risk of heart disease and stroke. It promotes healthy bones and reduces even the frequency of migraine attacks. So it helps if you are into exercise, improving your exercise performance as well. Now, for those people who have anxiety and depression, I actually sometimes suggest taking a very high dose of magnesium glycinate at night, which actually helps with sleeping and anxiety as well. It lowers the inflammation and pain, or it may lower the inflammation and pain. And sometimes some women even benefit from it when they have premenstrual syndrome. You know what it is if you have it, right? I don't have to explain it. But the dangers and adverse effects of consuming magnesium is also there, right? So anytime you are consuming something that too much, especially the ones that are not magnesium glycinate, like I said, diarrhea and stomach aches may happen. So make sure you do not overdo on those magnesium supplements and try to stay away from the chloride, the magnesium chloride, gluconate, oxide, and so forth. Also, some people, if they really have problems with magnesium pills, they may consider using a lotion or oil, but sometimes it even affects some people's skin as well. If you are using lotion, and you need to make sure that you test it in a small area first. So magnesium can cause toxicity as well, like everything else. And if you really want to die with magnesium, you have to really try hard, but I'm not recommending it, but it can really cause vomiting, difficulty breathing, irregular heartbeat, cardiac arrest, if you especially are prone to have rhythm problems. It can also affect your kidney function if you do too much of it. And if your kidneys are shot, you may not even excrete it, then you're in real trouble. But there is really no adverse effects from eating too much magnesium. You cannot really eat too much magnesium. It's going to be very hard to do. Because what happens is your body regulates and removes extra magnesium pretty efficiently. But if you're magnesium deficient, or if you think that you're magnesium deficient and you have diabetes and prediabetes, consider taking Sugar MD diavitamin, for example. But also you can discuss with your doctor to see what other help you can get. So that's it, everybody. Thank you for watching. Please remember to subscribe, share, and check out our website, sugarmds.com. You will be glad you did. And I will see you in the next video. Hey guys, I hope you're enjoying this channel so far, and I hope you subscribed already. If you didn't, do it. And if you did, watch this video right there. I think that will help you too.